Once again, really my distinct honor to introduce our next speaker, Dr. Janis Blair, my academic mentor and my friend here in Arizona for many years. She speaks a great deal. She's well sought after, and when I asked her to speak on this topic, and she had many other commitments, she said, "Only for you, Anita." So we're very fortunate to have Dr. Janis Blair speak to us today about sexually transmitted infections. Thank you. Come on up, Janis.
Objectives. My goal here is not to provide a comprehensive look at all sexually transmitted infections. That would be too much for the time allotted, but really just to have you, after this talk, be able to cite the current epidemiologic trends to describe antibiotic-resistant challenges that are currently plaguing the infectious disease community, and to understand STI screening guidelines. And I've been set up very nicely by both of my predecessors in the talk. So I do want to let you know that just like for menopause, there is also an app for sexually transmitted infections from the CDC. It is just for treatment only, but it is still quite useful. They don't have anything that talks about screening, so that would have to be, if you wanted to look up a particular CDC guideline, that you'd have to look that up. So we'll look at trends, and the first thing to note, and I saw some of the statistics already presented, but STIs are at an unprecedented high. And that is despite the fact that we have vaccines for some of them, and despite the fact that we have antibiotics for some of them. Young people, as we have heard, are active, and they account for at least 50% in some of the infections for all the STIs reported in the U.S. But if you take a demographic group that has more, that the men who have sex with men have more STIs than any other demographic group. So whenever you pull out public health statistics, you're always going to find them that feel a little bit stale because of the year that they are reporting on, and so don't be discouraged that I'm going to be showing you 2015 and 2016 data. The 2016 is only a few months hot off the press. That's just the way public health data is. So what the highlighted trends from the CDC about sexually transmitted infections for 2016 was that there are more than 2 million cases for the last